This segment is brought to you by Greenville Dermatology. Trust your skin to the best.
Well, May is indeed Skin Cancer Awareness Month, and so we have with us board-certified dermatologist Dr. Matthew Miller, who is just in time to, I believe, scold me for being out on a stand-up paddleboard all weekend and having all this sun on me.
You had sunscreen on.
Look a little tan.
Well, way more tan than I usually do. I did have sunscreen on. I have a feeling you're going to tell me not strong enough, but we're going to go through and talk about all of the different preventative forms. But let's first talk about why this is so important and the statistics that may just sober up a few people.
Well, 1 in 5 Americans will develop skin cancer in the course of their lifetime, and most people don't realize that it's the #1 diagnosed cancer of all cancers. It's diagnosed more than all lung, breast, colon, and prostate cancers combined.
But it's not all sun-related, is it?
Pretty much it is all sun-related.
Really?
Yes, sir.
Okay. Well, now, we've got some stats, but now there's some tips that maybe will help us to prevent that.
I would assume maybe the time of day that you're outside would help.
You want to try to avoid being in the sun between 10 and 4 if you can. So if you have to mow the lawn, try to do it after 4 or before 10. Wearing sunscreen when you go out, and I think a lot of people don't realize how much sunscreen you have to put on in order to get the SPF that's advertised on the bottle.
What's a good SPF?
Well, you want SPF 30 or better, but to cover your body you need a whole ounce of sunscreen, and most bottles of sunscreen only contain 4 ounces, and so some people will buy a bottle at the beginning of the summer.
Think it should last all summer?
And at the end of the summer they still have some in the bottle.
Which probably means you're not using enough.
That's correct.
How about the spray? That's a lot easier. Is that no good?
The spray, it has an SPF of 30 as long as you get enough spray on your skin. But, typically at the beach I'll see a mother spraying her children, and the spray's going all over the place with the wind and not actually getting on the skin. So, spray it in your hand and then apply it on the skin. Tends to work better.
All right, now tanning booths we've all heard about, but it said try and avoid UV tanning booths. Is there one that isn't?
Well, all the tanning booths are UV,
right?
Ultraviolet radiation. They used to have UVB bulbs in them, which would cause burns. Now they have UVA bulbs in them. However, the UVA bulbs are no safer than UVB bulbs. In fact, there's some cancer centers think that the UVA light is the actual light that causes skin cancer and not UVB. So,
isn't there a tax on these places now or something? Don't they want to tax them?
Well, 31 states have a rule now that you have to be an adult in order to go to a tanning bed.
Okay.
Right.
Well, now you've got a skin screening clinic coming up, but by appointment only. Why don't you go over that real well?
Every year during May, the dermatologists in town all get together and we provide a free skin cancer screening clinic. It's hosted this year by St. Francis Downtown. It alternates between St. Francis and Greenville Hospital System. This year it happens to be at St. Francis Downtown. You have to call the number on the screen in order to make an appointment for that. But everyone can come and it's completely free.
Okay.
Should you wear a bathing suit?
Wear a swimsuit so that you can completely undress and you still feel comfortable with us examining you. Of course, there'll be private rooms that we screen you in.
Okay. Are there certain things that you can tell us to keep an eye out so that in between our screenings, we should alert a doctor?
Yeah, you want to look for a mole that's changing shape or size or color. Anything that's bleeding or growing on your skin, you should have it checked out immediately.
Is it okay if you suddenly see a freckle or mole that you didn't see? Could that be okay versus?
I think it's always safe to get it checked out just so you know for sure.
Should you see a dermatologist with any certain degree of regularity, like, physical? I mean, should we see you guys every 6 months or every year?
Once a year. Unless you've had skin cancer, then you should come more frequently.
Sure. That's very interesting. Now tell us again where you're located. Do you work through St. Francis, or are you a private?
I'm a private practitioner, but my office is located at St. Francis Downtown in the Medical Professional Building.
And it is Skin Care Awareness Month, and I know with the screening clinic you give of your time. That's a freebie on your part. Thank you for that.
Yes, sir.
I should also add that you do have some openings for new patients, right?
Yes, ma'am.
So if someone does not have a dermatologist, certainly.
We'd be more than happy to see him.
Dr. Miller, and now you feel comfortable because you've all been introduced to him.
His complexion looks so darn good. Now, what are you doing different than
Because he
us?
takes better care of his
Well,
skin.
he's a young
than we
man.
do.
That's part of it.
I wear sunscreen.
There you go.
Golly, got all the answers, hadn't he?
Thank you so much.
Thanks,
Dr.
Doc.
Miller.
You're welcome.
We appreciate it.
We appreciate
Thanks for
it.
having me.